Hi, this is Dr. Eric Suh. He's from Eastside Primary Care and Wellness. I wanted to do a blog today about cardiovascular disease. Currently, cardiovascular disease is still the #1 cause of leading death in the United States, more than any other disease combined, which include cancer, other type of death in the United States. So we really want to be proactive about screening for cardiovascular disease. If you have risk factors such as obesity or a family history of heart disease, diabetes, high blood pressure, high cholesterol, if you're a smoker, if you're over the age of 50, if you're a male patient, even females now are catching up. So these are all risk factors, and we should be doing our diligence in trying to screen for that. So if you have any symptoms like chest pain, shortness of breath, dizziness, chronic fatigue for no reason, exercise tolerance goes down, when you exercise and you're having difficulty with breathing or chest discomfort, these are all indications for doing a stress test. And I'm about to do one right now, and I will record that for you, so stay tuned. Alright, so I am all hooked up to do my stress test. You can see that here, and you can see that it goes right there. And I will show you what a treadmill test is like as I get going. Alright, so the treadmill started. This is Michael, who's our ultrasonographer, who's going to be doing my echocardiogram and my carotid Doppler. I've done my neck over here on both sides. He tells me I have a little bit of plaque in my left bulb of my carotid artery, so I need to watch that. And as you can see, there is the EKG, and this tells me how fast I'm going. And this is all going to be captured, and I will be able to read it. And then we also have a cardiologist that will read the echocardiogram and my carotid IMT. And I will let you know how I do once I'm done, okay?
All right, well, we're checking back in. We're exercising Dr. Suh here. We're about 7 minutes and 25 seconds in. His heart rate's only 126 beats per minute, which is consistent with Dr. Suh's story, which is that he does some physical activity. One of the cross benefits that we see when we do the cardiac stress testing is we can actually tell what type of benefit your cardio is producing. So for example, someone who's doing a lot of cardio should take us a bit of time to get their heart rate to rise. So we should have more of a work product happening. And then we should actually have a rapid recovery. That heart rate should come right back down again. If we see very rapid increase in heart rate as we just start the treadmill, then we know that there's a possibility of a deconditioning, or the cardiac exercise is not being pushed hard enough. And the same thing holds true in recovery. If we don't see a rapid recovery, again, it's telling us that the cardiac reserve could be better. One of the other components that we get, which I'm going to do right now, is we actually check the blood pressure throughout the entire examination, making sure that it's appropriate. Blood pressure should go up with exercise appropriately, but not excessively. So we can actually see if there's any type of pre-hypertension that manifests itself while you're exercising. It's just another way to make sure that your workouts are being performed safely. Let's go ahead and check Dr. Suh's blood pressure and make sure that he is safe. Good, and as you can tell, every person's maximum exercise endurance is going to vary. It's going to vary by age, and as you can see over here on the EKG, the heart rate is already starting to increase, so we're already up to 145, so we're starting to definitely see it pick up. And as you can see, we have some criteria here that we look at. We look at our total time that we're on the treadmill. We use what's called a Bruce protocol, which means every 3 minutes we have an increase in speed and inclination. And then we also have our target heart rate goal, which is 220 minus your age. So we're looking for 172. Dr. Suh's right around 150, 151 right now, and plugging along.
Whew. This is exercise.
Dr. Suh should have worn his headband today.
Ninja!
Great. So now one of the most important parts of the stress test, which will be a little bit different than what you would do in your average gym, is we do not have a cool down period in the test that we're performing today called the stress echo. What we have done is we use the ultrasound machine over here. We'll take a little look right over here. And the ultrasound machine was used before the exercise to take all of the pictures of Dr. Suh's heart. Those pictures are locked away right here, and we're waiting for the in-post portion of the test. And as soon as Dr. Suh reaches that 172, which hopefully is going to be in a minute here as we just went up on him, and we'll get him back over to the table and take those pictures immediately after exercise to capture how well that heart is contracting. So in 10 seconds, we'll go ahead and come into recovery. And we're going to go ahead and go to recovery. Excellent job. And we're going to go ahead and stop that trip. All right, we're going to go back over to the table, left arm, left side. As you can see, this part is a little hectic because we've got to get some pictures extremely quickly of his heart. Go ahead. And as you can see in the pictures, that the heart is beating extremely hard, which we would expect in post-exercise. And if the test were abnormal, what we would see is a region of the heart would fail to squeeze. So we can see how that heart is squeezing in. Good, and we can see the challenges with breathing as well. That's why we use state-of-the-art equipment here, which actually allows for that breath and takes the pictures in between the breaths. So what we'll do is we'll take those pictures, put them all together, and evaluate them with the pre-pictures.
All right, so this concludes the stress echo for myself. The EKG looks pretty good. I don't see any ST depressions, which means that I'll have some blockage. If I see ST elevation, it means I'm having a heart attack. I'm glad I'm not having a heart attack. Anyway, the picture that Michael took does get read out by the cardiologist. They send me a report in 2 weeks, and I'm going to take a look at that report, and I match it with this EKG. It's about 90 to 95% sensitive, so you can tell within about 90% to 95% whether I have a significant heart disease or not. The carotid artery test, the carotid IMT, also gets sent back in about 2 weeks, and I'll take a look at that result as well and see how much plaque that I have here. Plaque here will be risk factor for a stroke. If I have plaque in my artery to the heart, there'll be a heart attack. And again, the reason why I'm doing this is to screen for cardiovascular disease, the #1 killer in the United States still. More than combining cancer, smoking, car accidents all combined together. So if you guys are worried about prostate cancer or breast cancer, yes, worry about that. But heart disease is still #1, and we should be very diligent about screening for that as well. All right, hope that answers some of your questions, and let us know if you have any questions.